Okay, we are continuing our next section. Again, we are looking at chapter 16, and we're talking about the pharmacy technician role. So, as mentioned, the pharmacy technician may be involved in looking at how well the patient is taking that particular drug. This may entail retrieving drug levels, lab values, and other patient-specific information, such as blood pressure, fever, from the patient's chart, and or from the hospital computer system. And they may be also asked to run reports. So this is something that's a little bit different in terms of the role of a pharmacy clinician within a hospital setting in comparison to a community pharmacy setting. Since community pharmacies don't have patients directly, being able to monitor the patients in terms of monitoring drug therapy is a role that is unique in comparison to the community pharmacy um, that is found in a hospital pharmacy setting. Okay. Other things that may occur that's different than what you find in a community setting is the pharmacy technician may act as an investigational drug service. In the hospital, they conduct drug studies. And remember, we talked about that in relationship to clinical trials in humans. The pharmacy technician often assists the investigational drug pharmacist by preparing and delivering study medication for the patients enrolled in drug studies. And so there's a lot of paperwork that are involved. And so a pharmacy technician may have a special training in order for them to complete those work. Another thing that's also very important for pharmacy technicians in the hospital is what we call inventory control. Inventory control, the pharmacy technician is responsible for maintaining the pharmacy stock. This is something that's also very similar that occurs within a community pharmacy. So that may be including ordering, checking the pharmacy invoices, handling drug recalls if there are any shortage or emergency drug procurements. And so this is something that is very, very important. Narcotics control substances. Many hospitals have a pharmacy technician who helps coordinate narcotic drug distribution. This involves ensuring the security of narcotics when receiving, preparing, and delivering them to the nursing units or the automated dispensing cabinets. Okay. Another thing that they may also do is called cart fill. Many times, medication goes directly from the pharmacy onto the floor, and for each particular patient on a particular cart. So in hospital and manual cart fill, technicians will fill the medical carts. A lot of times there may be automation. For example, there may be pharmacy robots and that move medication throughout the hospital. And so the pharmacy technician may be responsible for ensuring that the automation process of those particular equipment works well and filling them with their needed medication. IV clean rooms. This is involved in the preparation of sterile intravenous medications. For example, we talked about 0.9 saline solutions. That is important. Intravenous feeding apparatus that may be needed to be repaired. Chemotherapy. Pharmacy technician may be involved in chemotherapy. When we talk about chemotherapy, is a treatment. Medication is used for treatment of cancers, and those particular pharmacy technicians will receive additional training on how to handle and prepare chemotherapeutic agents and other such drugs. Quality assurance, very, very important. This conducts the inspection of most areas and other areas in the hospital that store medication, making sure that everything is done under federal and state law. And so a pharmacy technician may be trained to be involved in such quality assurance. And then people are promoted, and an individual can become a pharmacy technician supervisor. This also occurs within a community pharmacy, but also within a hospital pharmacy setting. And this is a leadership role that includes managing a team of hospital pharmacy technicians. The supervisor is often responsible for the training, creating work schedules, and completing annual evaluation for all technicians. Then, of course, staff development is very important. So the goal of staff development is to improve the knowledge and skill of pharmacy technicians by providing staff training materials, reading assignments, demonstrations, and written or practical tests. And that may fall under the guise of the pharmacy technician supervisor. Okay, let's move into the next area, which is very, very important. This is talking about hospital pharmacy areas. So the inpatient pharmacy is the area of hospital responsible for medical preparation and distribution. In hospital that have satellite pharmacies, the main inpatient pharmacy is called the central pharmacy. So what's a satellite pharmacy? Well, as we talked about, medication is stored in many different areas within the hospital. For example, you may find it around the nursing unit, and next to it, there may be a list of medication in which the nurse or physician need not to go to the main pharmacy. And that may be right there. It could be very simple pain relievers such as aspirin. It could be something that takes care of nausea, like Pepto-Bismol, etc. But it's very readily so that they don't have to call the pharmacy every time they need medication. These are called satellite pharmacies. In most hospitals, the central pharmacy is open 24 hours a day. And then you have a sterile product area or clean room that's also located within the hospital. So again, instead of having some distant compound company to make a particular product, they are able to make their own product to meet a specific need for the patients within the pharmacy or central pharmacy. Okay, so let's look at some of the definitions, which are very important to give us a better overview of hospital pharmacy areas. We have an inpatient pharmacy, a pharmacy located in the hospital that services only the patients in the hospital and its ancillary area. We have outpatient pharmacy, a pharmacy attached to the hospital that serves patients who have left the hospital or who are visiting doctors in a hospital outpatient clinic. Pharmacy satellite, a branch of inpatient pharmacy responsible for preparing, dispensing, or monitoring medication for a specific patient area. A lot of times, those particular pharmacies, and we talked a little bit about that in terms of also at the nursing unit, where they have storage of medication. You have what is called unit inspection, which can be done by a pharmacy technician, supervisor. A review of the nursing unit to ensure compliance with hospital medication policy. Another definition that you should be familiar with is called batching, preparation of large quantities of unit dose oral solution suspension or small volume parenteral for future use. Again, the central pharmacy is the main inpatient in pharmacy in the hospital that has pharmacy satellites. And then again, clean room is an area designed to produce sterile products within the hospital. All important. Right. Again, this is just a review of what we talked about in terms of inpatient pharmacy. Located inside a hospital, serve only patients in the hospital and its ancillary areas. Pharmacy satellites, branch of the inpatient pharmacy, responsible for preparing, dispensing, and monitoring medication for specific patient areas. And we talk about areas like pediatrics, the OR, the oncology. Central pharmacy, main inpatient pharmacy, which also have satellites. Most medications are prepared and stored within the central pharmacy. And then, of course, the sterile area is also located within the central pharmacy. All of this is under a regulation. So, and it's under the regulated code of USP. This is, and it is a set of regulation issued by the U.S. Pharmacopoeia. These regulations include a strict set of policies and practices that must be followed by any pharmacy that prepares compounded sterile products. The policies are intended to decrease infection transmitted to patients through drug preparation and better protect staff in their exposure to pharmaceuticals. Right? And so this is a very important stand trying to ensure that the medications that are prepared within the hospital follow a particular set of guidelines. Okay, let's look at pharmacy satellites. So again, in different places, you have smaller pharmacies. And the purpose of that is to prevent the physician, the nurse, healthcare provider, they haven't run down to the central pharmacy at all times. The medications are right there. Okay, and they are managed by the central pharmacy. So you have could be in a pediatric setting where children is being taken care of with an operating room. You don't want to always have to call up for a particular medication if it's stuck close by, especially very busy hospitals in which you may have 5, 6, 7 operating rooms going at the same time. The pharmacist there can be able to assist. The pharmacy there can assist the need of the operating doctor. In chemotherapeutic, where chemotherapeutic treatment is necessary in oncological satellites, you may have a smaller pharmacy located there. So a centralized area for storage of drug products or inventory may be part of the pharmacy department, which is the case. A number of hospitals have investigational drug services. That means they do human clinical trials we talked about. And there are specialized pharmacies within the setting that deal solely with technical drug trials. Quality assurance may be a area in which pharmacy technicians are involved in, making sure that there's proper storage of the medications. And then the doctor office or clinical clinic, along with an outpatient pharmacy, you may find pharmacy satellites in those particular area. Okay. So these pharmacies provide prescription medication to patients visiting their doctor, and they run very similar to a retail pharmacy. So many hospitals have a separate wing of physician offices. Okay, and that's in section 2.